Hello, everyone, and welcome again. My name is Megan Marcus, and I'm the founder of Fuel Ed. I'll be leading our session today, co-leading our session on prioritizing people, purposeful investments to better support student and teacher mental health. Feel free to continue to introduce yourself if you're just arriving now. In this session, we'll be outlining the priorities identified by teachers for addressing student and teacher mental health, as well as introducing you to a framework for mental health in education designed by Fuel Ed that we hope can support district and school leaders as they engage in this next season of planning and spending for our schools. I'm joined by my fabulous colleagues from both Fuel Ed and Teach Plus, including Roberto Rodriguez, the CEO and president of Teach Plus and nominee for Assistant Secretary of Planning, Evaluation, and Policy Development at the U.S. Department of Education. Also, Mark Teo, the Senior National Director of Knowledge and Research at Teach Plus. Lindsay Sobel, the Vice President of Policy and External Affairs at Teach Plus. And of course, Kelly Munger, Dr. Kelly Munger, a partner at Fuel Ed, who leads up our research and development work. Our agenda will be as follows. I'll be kicking us off with a welcome message and sharing some background context on our partnership, followed by Roberto Rodriguez, who'll be sharing how the Biden administration is thinking about mental health. Next up, Lindsay will be sharing more context about the federal funding opportunity available at this moment, before Mark and Kelly dig in to share the juicy details you're looking for about that survey that we administered, the findings, and the powerful framework for mental health. Then we get to hear directly from the voices of teachers and district leaders who are on the ground in a panel before we move to recommendation and advocacy steps that can be taken to make a difference. While we won't have time for a formal Q&A today, we'd love to engage with your questions and reactions. So just use the chat box along the way to do that. And our teams will respond to get your questions answered or responding to your reactions to what you're hearing. Let's go ahead and get started. In the time since COVID-19 forced schools to shut down in March 2020, the educational challenges arising from the pandemic have been well documented. The pandemic's impacted every aspect of teaching and learning, bringing new complications to providing quality education and compounding existing inequities and challenges across the K-12 system. All of this has impacted the mental health of educators and students. Students have experienced poor mental health outcomes, reporting increased anxiety, stress, and loneliness as a result of COVID-19's impact on schooling, their everyday lives, and the health and financial well-being of their families. Mental health concerns aren't just limited to students, though. Teachers, too, have experienced increased burnout, with studies finding 3/4 of educators reporting frequent job-related stress and 1/4 reporting symptoms associated with clinical depression. Unfortunately, this crisis now promises to extend into a third school year. And so with significant federal funds being made available to schools and districts, our organizations, Teach Plus and Fuel Ed, wanted to know what teachers thought about how these resources could better support student and teacher mental health. So we surveyed 500 educators nationwide and distilled the findings into a report that will be shared with you following this session, and can hopefully serve as a guide for school and district leaders, as well as state leaders, who are currently making important decisions about how that funding will be used. Before we jump into the findings, though, a little background about both of our organizations. As many of you know, Teach Plus is a nonprofit organization whose mission is to empower excellent, experienced, and diverse teachers to take leadership over key policy and practice issues that advance equity, opportunity, and student success. Our friends at Teach Plus are dedicated to empowering educators as leaders and lifting up educator voice so they can influence and lead the field. They're experts at putting teacher voice and power at front and center and helping educators be agents of change. Fuel Ed, for those of you who don't know, is a nonprofit organization that specializes in developing educators socially and emotionally. We partner with schools to develop educators' interpersonal skills, their self-awareness, emotional well-being. We at Fuel Ed recognize that while the acute stressors of COVID-19 have drawn attention to the need to address mental health in schools, the social emotional needs of educators and students have always been present. We firmly believe that student social and emotional learning requires socially and emotionally intelligent educators. and that trauma-informed education must acknowledge not only student, but also educator trauma and to build secure relationships that provide the conditions for optimal learning and development. Putting both of our organizational strengths together, this partnership aims to elevate the mental health needs of educators and students and empower districts nationwide to invest in bolstering mental health and emotional well-being in schools. I think we all probably agree this is a pivotal moment in the history of our education system, a moment to strengthen the mental health and social emotional supports available in schools. We're so excited to welcome you here today with us as critical partners in this effort to promote, normalize, and embed mental health infrastructure in schools and create school cultures that sustainably support educator and student well-being. With that, I'd like to introduce and invite Roberto Rodriguez to speak about how the Biden administration is thinking about this important issue.
Well, thank you so much, Megan. And thank you all for taking time out of your day to be with us today on this important webinar. We at Teach Plus are so appreciative to be in partnership with you, Megan, and with the team at FuelEd on this important work. And before I get started, I just want to acknowledge and thank all the talented individuals who made today's webinar possible and who contributed to the report that you'll all receive at the end of our webinar today. So to the remarkable FuelEd team, Megan and Kelly, to all of our team at Teach Plus, and especially our research and knowledge team led by Mark Teo and including Amber, Ravnell, James Jack, our outstanding Teach Plus senior research fellows. We're just so grateful for all that's gone into today's report and today's conversation. The data and the recommendations that we'll discuss in today's webinar today, they amount to nothing short of a clarion call for policymakers and for school leaders to focus on the whole child and to focus on the whole educator. And as Megan has already pointed out, these social and emotional needs of students and of educators are inextricably linked. We've already heard the past 16 months of the global pandemic, its impact that has been brought down in terms of challenges for students, for families, for our educators. We know we've encountered and seen disruptions to learning and students contending with learning across a digital divide. We've seen economic and health burdens posed by this pandemic that have exacerbated the challenges that many students and families face in accessing healthcare. We've seen our educators facing a common moment around the country of navigating the challenges of remote teaching and learning. And so all of these factors have converged and they've contributed to the rising social and emotional and mental health needs that students and teachers are facing today. And we have to acknowledge that those needs threaten to compromise the well-being of students. They threaten to continue to contribute to feelings of burnout and teacher attrition that we've already seen on the rise if they're not addressed. So our hope today is with this report and this conversation that we can address those needs. We can take up that collective charge to meet the moment with an eye toward change, toward shifting and changing our mindsets and our actions to prioritize social and emotional and mental health needs for our students and for our educators. And to also shift our education policy and our systems to better address the whole child and the whole teacher. So it's clear from the data that you'll hear more about today that teachers overwhelmingly believe that schools can and should do more to respond to the mental health needs for students and for teachers. And today's report offers a really great and helpful framework of regulation, reflection, and relationships as the formula to really restore and renew the well-being of students and the well-being of teachers in our system. I know it can be sometimes easy to get overwhelmed with all of the individual needs and the individual stories that are behind this data that we'll talk about today. I know it has weighed heavily on us at Teach Plus. It has weighed heavily on me to hear from our teacher leaders across the country over this past school year and since the beginning of this pandemic about the stress and the trauma that they face on a day-to-day. But I truly believe our charge is in looking forward to opportunities that we can create together to shift our focus and in our attention in ways that are going to be more constructive for students and for educators. So we can contemplate several big shifts coming out of our conversation today. We can contemplate a shift to refocus and rethink our school structure and how we design curriculum and teaching and learning in our schools to more explicitly support the social, emotional, and mental health of students. We know our teachers need more time to collaborate, to build solutions around our students outside of the four walls of their classroom. They need breaks in their teaching schedules. They need increased time off and paid leave to care for their own mental health. We can contemplate a shift in how we focus on building and sustaining positive relationships with our learners. We know those relationships are key. They are the connections our students build that contribute to their success and to their feelings of safety and security in their schools. We have known this for a long time, but this pandemic has brought so clearly into view the need to attend more to school culture and school climate, the need to build and bolster those relationships between our students, the adults around them, and their peers as a major factor and asset for their well-being and success. Third, we can contemplate a shift in teacher professional learning that focuses on social and emotional well-being for students. We know and we've heard from our teachers about their desire to build up their toolbox with more opportunities to respond to the social and emotional needs of students, to conduct wellness checks, to create positive behavioral supports in their schools, to better understand and practice culturally competent and responsive approaches to social and emotional wellness for their students. And finally, we can contemplate a shift in how we allocate and support human resources toward this challenge. The need to dedicate staff and to dedicate specialists that are focused on student well-being and teacher and student emotional and social and mental support is present throughout this report. It's often presented and we find it in teachers' own words. This is, again, a need that's been long neglected in our system. And too often our teachers have been left to shoulder the burden and the work of attending to social and emotional needs of students all on their own. So we can change that with this report. We have an opportunity as a country to make a bold new investment in expanding the number of school-based health professionals in our schools. We have the opportunity to double the number of counselors and nurses and school psychologists and social workers that can attend to and care for the social and emotional and mental health needs of our students. We can also make a game-changing investment in full-service community schools and wraparound services that we know our students and their families need to stay healthy and to thrive. So all of these proposals are before Congress and deserve careful attention and consideration moving forward. And finally, I'll just say, at Teach Plus, we believe that our teachers are the most powerful agents of change. We dedicate our work every day to growing and lifting up their vision and their ideas and their voices to bring about the solutions that our schools need. And we believe that teacher leadership is not just a nice to have, it is an essential ingredient in driving equity and opportunity and improving outcomes for students. So throughout this report, you'll find a call to engage, include, and listen to our teachers in meeting this moment. I am thrilled that we have with us today outstanding Teach Plus Senior Research and Policy Fellows, Mel and Alyssa, our remarkable Fuel Ed educators, Sherry and Elkridge, and they'll share and bring to light more of these findings and recommendations in their own words. So thanks again for being with us, and I'll turn it over now to our Vice President for Policy and External Affairs here at Teach Plus, Lindsay Sobel.
Thank you, Roberto. So So I'm going to start just by sharing a story about a teacher. Christian Linderman in 2018 found that as much as she was passionate and dedicated and knew how to teach English, her students in Houston sometimes were unable to access the learning because they were experiencing the effects of trauma. And it took until she had training in trauma-informed instruction practices before she was able to ensure that all of her kids were feeling emotionally safe and ready to learn. And so she took that experience and began a call for trauma-informed instruction practices across the state of Texas. Other teachers joined her, involved with Teach Plus, and ultimately they were able to successfully advocate for a law that now requires that all teachers in the state of Texas receive training in trauma-informed instruction. When the pandemic began, they were able to advocate for the Texas Education Agency to invest some of its funds in ensuring that that training was high quality and outstanding. And the agency actually partnered with Fuel Ed to create a training called Project Restore. So that is now available for free on the Texas Education Agency website. The reason I tell that story is because we know that when smart investments are made that are teacher driven, that it can make a huge, huge difference for students and families. And if we share the screen right now, I'll share there are significant federal opportunities for these investments, and that's really what this report is about. So in March of 2020, the federal government invested $13 billion through the CARES Act. The Consolidated Appropriations Act invested $54 billion in December of 2020. And then most recently in March of 2021, the federal government invested $126 billion in education through the American Recovery Act. And if we go to the next screen, I'll share how Congress has thought about these investments. So the fund within each stimulus package is called the Elementary and Secondary School Emergency Relief Fund, the ESSER Fund. Those funds are available to be spent very broadly on priorities of the federal education investments, including on a variety of topics. I want to zero in on this second to last bullet, investing in wraparound supports and community schools. So we know now that we have the dollars, they are here and available, and that a lot of districts and state leaders are really striving to make sure that they invest those dollars effectively. If we go to the next slide, I'll share a little bit about how teachers have really been involved in that response. As you are here today, you're going to hear about the paper Prioritizing People, produced in partnership with Fuel Ed and Teach Plus. Starting all the way at the beginning of the pandemic, Teach Plus teachers across the country, like Christian, came together and helped to conduct teacher-led research on what teachers' responses were to the pandemic, producing the paper Barriers to Bridges. That paper produced the data that 89% of teachers were more worried about their students' mental health during the pandemic than prior to it, and really spurred the organization to work with teachers in an ongoing basis on this issue. We've also produced a teacher-driven paper called Invest Today, Thrive Tomorrow that describes 3 significant investments that can be done with ARP dollars, including advancing student and teacher mental health to help students thrive going through and beyond the pandemic. Teachers did not stop there. They have published 103 teacher-written op-eds on whole child and student mental health since March 13th of 2020. They have also advocated for policy change. So stories similar to Christian's, where she was able to get, rally fellow teachers working with her Teach Plus Policy Fellowship. That has occurred in 11 states around the country, with teachers really advocating for strategic investments of stimulus dollars. And finally, teachers through Teach Plus have been leading instructional leadership efforts, one through a change agent program where teachers are leading change within their schools. When given the choice, many of them choose mental health topics that they want to lead the change on. And then most recently, Teach Plus teacher leaders have partnered with the Chan Zuckerberg Initiative to support the production of an app that helps students and teachers build relationships and build social and emotional learning collaboratively together. That's called along.org. You can find it on that website and learn more about how teachers can use that app to asynchronously build relationships with their students. So So I share all of that to say that there is a long tradition of teachers really highlighting the importance of student and teacher mental health. I always say, no matter what question you ask teachers, the answer is always student and teacher mental health first. And that is really has been the call from Christian and so many other teachers around the country to get started on this work. And I'm now going to turn it over to our Senior Director of Policy and Research, Mark Teo, who is going to share the methodology and the findings from this report, Prioritizing People.
Thank you, Lindsay. Thank you to our attendees for joining us today. My name is Mark Teo. I'm the Research Director here at Teach Plus. The idea for this research that we were about to share with you originated with Teach Plus teacher leaders from across the country who were observing that teachers and students continued to struggle with mental health issues throughout the pandemic. When they saw that federal funding was being made available to schools and districts to address the effects of the pandemic, these teacher leaders like Mel and Alyssa, who you'll meet later, wanted to elevate teachers' perspectives and ideas on how to best address social and emotional learning needs in their schools. Their idea was to conduct a survey of teachers, recognizing that classroom educators were uniquely positioned to understand the stressors students and teachers were experiencing. In collaboration with Feel Ed, we conducted a national survey of educators that led to a sample of 509 teachers across 29 states and the District of Columbia. The teachers who participated in our survey represent a wide range of teaching experience as well as teaching assignments. Johan, let's go to the next slide. We'll be sharing the full report with you soon, but I'd like to underscore a few highlights from our findings. First, teachers were clear that their schools could be doing more to support the mental health needs of students and teachers alike. Johan? When we asked about their students' mental health, 1 in 3 teachers said their school was offering the right amount of support. However, 60% of them believed that their school could be doing more. Johan, next slide. Perhaps more emphatically, when we asked teachers about their own mental health, they were clear that their schools were falling far short in supporting educator mental health needs. 72% of them said that their school was doing too little. So what are teachers asking for? Johan? In a series of open-ended questions, we gave teachers the opportunity to share their ideas for how to improve student supports. Examples from these open response questions are found here and throughout our report. In our qualitative analyses, we coded teacher perspectives into 9 categories and are sharing the top 3 with you right here. When asked about student issues, teachers were looking for on-site professional therapeutic resources, experiences, and professionals. They're also looking for direct mental health programming for students, and recognizing the particular toll the pandemic has taken on many students, are looking for non-academic experiences and activities. Let's go to the next slide. Likewise, when it came to addressing their own mental health, teachers were eager for professional development that would help lead to better mental health practices. Another big ask from teachers included on-site therapeutic resources and experiences, like meditation or yoga classes. One of the clearest requests from teachers had to do with time, carving out time in the day to fulfill their teaching duties, time to tend to their mental health needs, time to meet the increased demands that teaching during a pandemic was creating. Just time. When I talk to teachers about their work these days, this theme seems to resonate strongest with them, finding time and space in schools and out of schools to address the multitude of challenges they're experiencing as we begin a 3rd school year in a pandemic. So we'd like to encourage you to talk to teachers and educators about how to do this. They are full of creative and resourceful ways of rethinking how to use existing and potentially new resources to create the kinds of time and space they need to support stronger pathways to improve mental health. Taken together, teachers are asking that attention and resources directed at mental health be normalized in schools. That while there are clearly short-term needs being experienced by students and teachers alike, educators want long-term systemic solutions for addressing mental health and social and emotional needs. I'd like to invite Dr. Kelly Munger to talk more about what we learned and how schools can be strengthening pathways to good mental health.
Wonderful. Thank you so much, Mark. And if we could just advance the slide, would be great. So given the current challenges, the big question for the field is really how to focus these investments. If we increase the time and space for mental health, what to do? Well, the science of learning and development, along with the many voices of teachers represented in this survey, point to 3 potent ingredients that can restore emotional well-being and build resilience for educators and students alike. They are regulation, reflection, and relationships. And if we can advance the slide, collectively, teachers indicated in this survey that their schools could do a lot more to support these 3 pathways to support positive mental health outcomes. So to deepen our understanding of this last finding, let's unpack the science behind the 3 pathways. So we'll start with regulation. And what you see here on the slide is what Dr. Stephen Porges and Deb Dana call the autonomic ladder. And essentially, this is a powerful visual of the human nervous system. You can see that when we are at the top of the ladder or we are in the green zone, we feel calm, safe, social, ready to connect, grow, learn, and to flourish. And of course, to teach and regulate students, which is what a lot of us really care passionately about. But we, of course, as humans are constantly facing stressors, both big and small. Our nervous systems are actually designed to mobilize in the face of stress in an effort to help us survive. And the survival instinct sends us first down the ladder to what's called the red zone, where we might feel amped up, overwhelmed, and have energy to fight or run from the proverbial tiger chasing us through the jungle. For teachers, this red zone state might have looked like mobilizing every last ounce of energy in March of 2020 to move to teaching online with just a few days' notice. And ideally, the nervous system is really prepared to handle this surge of energy before then hopefully quickly returning to equilibrium and back to the green zone. But what happens when we are unable to outrun the tiger? What happens when 2 weeks becomes a year of daily stressors and unknowns of teaching through a pandemic? At this point, many of us may move even further down the ladder into a shutdown state, feeling numb or low in energy, perhaps sad, depressed, or apathetic. This is called the blue zone. You can see this at the bottom of the ladder. And although struggles with mental health have endlessly nuanced and varied expressions in individuals, we can generalize that whenever humans, or educators or students, are stuck outside of the green zone for prolonged periods, emotional well-being is diminished. Many educators, and I'm married to one, have reported living far outside of the green zone this year. They also report lacking the resources and support that they might need to recover. And so to summarize, humans flourish when they have the resources and capacities and conditions to both stay in the green zone during stress and or to return to the green zone in the wake of stress. This is the heart of regulation and being able to return to safety and calm after stress. Over time, practice with returning to a safe, regulated state lays the foundation for emotional well-being. And so given the stressful nature of teaching, which most of us here are familiar with, especially in the past year, but also well before this year, providing opportunities for educators to practice with returning to a safe, regulated state is essential for promoting physical and emotional health, as well as preventing burnout in the long run. And while self-regulation activities such as yoga and mindfulness and getting that time off that we've been talking about are becoming increasingly more common as pathways for enhancing teacher wellness, these strategies reflect a primarily solitary practice of self-regulation. It's important to note here that on a neurobiological level, self-regulation really isn't possible without first receiving care in relationships. And therefore, educators often need much more than just standalone self-regulation experiences to truly flourish. Why is this? Well, over the course of our development as social creatures, repeated experiences of being calmed and cared for through relationships enable us humans to develop the brain structures and the skills for self-regulation, for self-care, and really for resilience in the face of stress. And because feeling safe and seen within relationships enables our nervous systems to calm down in a process known as co-regulation, then providing opportunities for self-regulation and co-regulation really is essential to promoting physical and emotional health for educators and students. So unfortunately, in our survey, we learned that 69% of educators reported that their schools are doing too little to support them for regulating back up the ladder, back to the green zone. And so what can schools do at this moment to promote, right, this really core pathway of regulation? So some of the things that educators are asking for to fill this gap include quiet spaces, like we said, access to things like yoga and meditation. They're also asking for opportunities to co-regulate, such as through collective retreats or through more time just to spend together, having meals even, and having vulnerable conversations. And so we'll then move to exploring a second powerful pathway, which is related to restoring mental health for educators and students. This is reflection, which we define as the process of noticing and naming and growing awareness about our own emotions, our own needs, and even our own stories. Research demonstrates that reflective capacity is a key indicator of well-being. And when stress and trauma are unprocessed, our day-to-day experiences are more likely to be perceived as threatening, leading us to become more reactive, really in an adaptive effort to keep us safe. But higher reactivity, of course, makes daily life challenging for educators and students, which is why, especially after trauma, and I think after COVID-19, time for reflection is needed to make sense of, to process and move through and beyond difficult experiences. As a part of regulation, reflection should not be seen as a merely solitary practice. Sense making with the help of a trusted relationship is a powerful pathway for managing stress and healing trauma. That is why, in addition to time for independent self-reflection, educators and students need time to reflect collectively and to make sense of experiences together while receiving both validation and empathy. And so again, despite the importance of reflective practice, 71% of teachers reported that their schools are doing too little to promote this kind of practice. So what could schools do at this moment? What could we invest in? Educators have asked for things like collective healing circles, time to spend and reflect with a therapist or another mental health professional, or time set aside to focus on other reflective practices such as journaling. At Fuel Lab, we've experienced the power of reflective practice quite a bit. We host monthly empathy circles in which educators can show up and really unload their burdens, the ones they've been carrying around all week. Time and time again, after this experience of empathy, teachers tell us, I came in stressed and I left refreshed, or they might say regulated. In other words, this simple hour is a powerful way of moving back up the ladder. We also provide schools and districts a professional development program called the Whole Educator Collective, in which we carefully guide educators through an in-depth process in which they reflect on their own trauma and their own developmental and attachment stories. This process has a profound and long-lasting and cascading effect on educators' emotional well-being, including in some of our research, we found increased sleep, right? Increased rest and increased self-care, as well as improved relationships and self-awareness, all components of creating that green zone safety at both the individual and also the systemic level. And so this brings us to the final and foundational component of our framework, relationships, right? All educators need at least one safe relationship. In times of stress and crisis, we humans flock to one another for safety. And being felt, seen, validated, and supported takes us back up that ladder, providing the calm and support needed for humans to explore, grow, and flourish. And in this way, relationships, regulation, and reflection all work in tandem to move educators back up the ladder and into the green zone. And because care from others precedes self-care, perhaps solving the teacher's stress crisis is less a matter of asking teachers to put on their own oxygen mask, and more about ensuring that every teacher has someone who can help put an oxygen mask on with them. And so finally, 58% of educators reported to us that their schools are doing too little to scaffold and support secure relationships. And filling this gap, at Fuel Ed, we've discovered through years of working with educators just one simple and powerful way to build a culture of secure relationships. And this is a peer support practice that we call stewardship. Stewardship is really simple. Educators are matched in pairs and equipped with social and emotional skills like empathic mirroring or empathy and genuineness. Educators then meet weekly to share their current struggles and needs and to receive deep listening and care. And through this practice, educators are seen and felt on an ongoing basis. No one can fly under the radar, and building secure relationships actually becomes normalized and embedded in the culture. As one educator described her experience with stewarding, there's no other time in my week where I have an hour to speak uninterrupted about something of emotional weight. It is a pressure release valve and has helped me to move away from survival to look at myself as a human being, not just a teacher. So as you can see, the deep care provided to educators through the stewardship model hits all three of the pathways of our mental health framework. It demonstrates just how a secure relationship can help educators to both reflect and regulate, and hopefully to restore the resilience that is currently so badly needed. So we hope this framework for mental health will help you to organize the rich and varied findings that you'll see in the report that we've gathered through the voices of these 500 educators. And now we will hear directly from some of these educators themselves in a panel facilitated by Teach Plus's Lindsay Sobel. I will pass it to you.
Thank you so much. Thank you, Dr. Munger. It is really an honor and a pleasure to introduce our panel of educators. First, Mel Coriel, who is an English teacher and theory of knowledge teacher and the International Baccalaureate Diploma Program Coordinator for Indianapolis Public Schools, and a Senior Research Fellow at Teach Plus. Cherie Spencer is SEL Coordinator in Galveston ISD. Eldridge Gilbert is Chief Schools Officer at Coney Island Prep and a Fuel Ed alum, as is Cherie. And then finally, we have Alyssa Avila, who is TSP and College and Career Awareness Coach and a Teach Plus California Policy Fellow. So I'm going to start with a question for Mel and Cherie. So I'd love to hear, we've had an opportunity to hear about the mental health framework, as Dr. Munger discussed, through the 3 R's, relationships, regulation, and reflection. How does that framework map onto what you're experiencing in schools? And what are you hearing teachers are asking for? We'll start with Mel.
Sure. So it matches very well with what we hear in our school. And I just want to share a quick story that shows how well it matches in our context. So on day 2 of the school year, I'm in Indiana. We start school earlier than most. So day 2 was way back at the beginning of last week. 2 students were walking down the hall yelling at each other in my school. That happens frequently enough. They were yelling at each other and they walked between my colleague and me, and we both stood and listened. And there were curse words, there was body language that was, maybe in some context threatening. They were angry with each other. And when we listened to what one of the students was yelling, he was yelling, "Don't do this here. This is a good place. I want to be here. And I know you do too. Don't do this over a girl." And there were a lot of curse words in there, but that's what they were saying. And so Chris and I, my colleague, were able to hear that and respond accordingly, because later when we debriefed and reflected, what we realized was it was our mission being enacted, right? Like it was what we wanted them to do. And the way we got to this place was by last year starting an SEL team and asking the faculty in our building, what do we need? What do we need to get to that place? And what they told us was really regulation, relationships, and reflection. And it took a lot of work. If you Googled the name of our school, you would find that we're the school where a city police officer punched one of our students outside of the school 2 years ago, after the student had been involved in several fights inside the school. And I think after implementing, starting with adults, mental health services for them, it's a laundry list that I won't go into today, but after implementing an orientation week for students where we focus on establishing relationships and having proactive circles where we talk about how to resolve conflict, implementing grief groups, and putting signs on the door that say, this is a great place, we're happy you're here, please bring your best energy to this place, and let's keep it that way. It says it even more nicely than that. But after implementing those things that teachers told us to do, we saw a really quick turnaround. And that's with having been out of school for, in virtual school for a year of that 2 years. So I can't express more that these 3 words really do reflect what teachers are asking for and what professionals know are the best ways to address the issues we're facing.
Thank you so much. What a powerful story. Cherie.
I want to add to Mel on what she's saying is we are currently involved in professional learning as we speak the past 2 days, and teachers have just said, we need somebody to support us. We need somebody to be our voice. We need somebody to tell us to stop and breathe while they're doing it for students. And so what we have done in the past years and moving into this year is we have provided counseling for teachers. So Family Service Center has stepped up to the challenge and heard this outcry from the educators that we too have a mental health concern. We need to be healthy so we can be healthy for the kids. And so they have stepped up and offered this service to our teachers free of charge so that they can be supported. We have an SEL team that is here in teen health that are just stepping in to really focus on the adult piece when it comes to regulating our emotions so that we can be that role model for our students and how to regulate. I will say Empathy Circles has done amazing things for our staff this past year and provided them that safe space that you spoke to for them to strengthen those relationships, to kind of name their emotions and how to healthy coping skills, I don't want to say handle, but healthy coping skills around those emotions so that they can take on this job. This job is huge. So that is one thing that we have done here that has shown a lot of growth for our adults and just really called out to them. In education, we talk kids, but we have to help our adults if we want them to stay with us. We want them to stay in this program. So that is what we've done here in Galveston thus far.
Thank you very much, Cherie. Right, so another question for Eldridge and Alyssa. What are your hopes and aspirations for how schools can adjust to the moment? And we'll start with Eldridge.
Thank you. I was definitely going to wait. This has been a great event and great panelists. I'm honored to be here, and I feel like there's going to be better answers and responses from the next person. But as a district administrator, one of my hopes for our network is that we're really listening to families, students, and staff, and taking time to look at all of our policies and procedures with fresh eyes and with a lot more empathy and care and concern for the individuals at the heart of our work than maybe we previously have done. And then taking action. So not just like the listening part, but then also like what's the work that follows up with that, and the willingness to say, hey, we got this wrong and we need to readjust the way that we envision school and the way that we envision the job of a teacher and supports of a teacher to like meet people where they are given this moment of clarity and reflection that we have. In my network, that's looked a lot of ways that I don't think we're done yet, but bringing in outside consultants to do trauma-informed sessions, not just for teachers and staff, but also self-care sessions for those same staff and for families, to acknowledge the fact that we all don't have the tools and resources that we need on a day-to-day basis to calm ourselves down, to move up and down that ladder, as was alluded to earlier. Those skills are not inherent, and we don't do a great job of teaching them to our students. And so as adults, we're also coming into like these spaces unprepared for the stress that we feel. And so how do we bring in that knowledge and then create space and opportunities for people to respond to that. It looks like hiring more social workers, more counselors for our students, but also looks like supporting teachers by hiring folks if you can, or rethinking our benefits packages, the way that we ensure the mental health of teachers to make it easy for them to access the supports that they need. So my hope is that we continue to do that work and continue to question the ways that we have been doing teaching, right? Like we've been doing this for centuries. The population of people that were meant to be teachers are not the folks who are teachers anymore. And so we've got to, take a hard step back and say, maybe this doesn't fit the model. This model does not fit who we currently are seeking to serve at the, and our most at-need students, and then to find the courage and the resources to do things differently.
Thank you so much. Alyssa.
Hi, I'm going to take off my mask for a second. I'm working and there's lots going on, but I'm currently in LA. I work for LUSD at a small school in Echo Park, but I think my journey starts as a teacher in the pandemic and really feeling disconnected, not only from my work, but also burnt out like a lot of my colleagues. I then got an opportunity to work outside of the classroom and be able to serve teachers and be a part of the conversation when it comes to funding different initiatives at our school. And so I'm seeing this through two different lenses. And I think for me, I felt helpless because all of these decisions were being made on my behalf and I didn't feel like I had a voice. And so now that I'm able to share my experience as a teacher, but also be a part of the conversation, I'm seeing that so much more is getting done in the sense of where this money is going. And I am really happy and proud with the work from Teach Plus. I'm in the research SEL cohort. And so we developed the survey, which we then sent out to the teachers. That one question, what would you do with $1,000? We took it quite literally and we've given every teacher $1,000. And they're going to be spending it the way they want to, with the lens of they want to create a classroom culture that's inviting. Something flexible seating has been talked about, using it for different yoga materials in the classroom, using it to really support students because they know, because I know they know what to do because I was in that position as well. I've never gotten money to spend on anything. And so this is a dream. And we've told a couple of teachers, but Pupil Free Day, official day back is on Friday. So we're going to be able to share that information with everyone and let them decide, because that's what we're seeing from all of these results, is that teachers need to be heard and listened to and empowered to empower others. And so if they feel like they matter, then they will feel like they're doing their job and fulfilled and happy and passionate. And I think I'm a teacher first always, and even now I'm sad I'm not setting up my classroom, but I know what I'm doing here is impacting other teachers and students. And so continuing to take what I've learned from Teach Plus and what I'm continuing to learn outside of the classroom and be able to support in any way I can. And I think that's what other districts and people in charge should really take things like this literally and really see what the only way that we're going to move beyond this constant teacher struggle is if you really sit and listen and figure out what I can do for them and how to let them make those choices, because really teachers don't want to sit in another professional development or have to be trained. They want to be able to take what they know and implement it in their way. So that's my input. Thank you all for listening, and I'm sorry if it's a little bit loud over here.
Thank you so much. And thank you all. You are doing the work, you are leading and just bringing such incredible expertise. And that is really what this report about is, as Alyssa said, sitting and listening to teachers. I'm going to turn it back over to Megan and Mark to close us out.
Thank you so much. Really appreciate that fabulous panel. And we'll get the slides back up. But now we're going to turn to recommendations in our last few minutes here. We asked teachers in our survey what advice they had for policymakers and educational leaders. Based on their perspectives, we suggest 3 recommendations for school, district, and state leaders. Recommendation number 1, as you see here, authentically engage, include, and listen to teachers when considering how to serve the mental health needs of educators and students. We urge the leaders in our field to engage educators who are closest to students and have a clear sense of what's needed. At the conclusion of our report, which you'll be getting shortly, you're going to find a listening tool questionnaire that was co-developed by our organizations that we encourage you to use in your home district as a starting point to understand what teachers in their schools need to address the current mental health challenges. Recommendation number 2, let's promote initiatives and practices that support and strengthen that formula, as someone alluded to: regulation, reflection, and relationships for students and teachers alike. We need to remember that a well-supported educator has a positive and cascading impact on students, on families, on school culture. And so when we take care of teachers, we are taking care of students. That is why we urge state, district, and school leaders to normalize the focusing on the development of not only the whole child, but also the whole educator. This includes ensuring that federal and state funds can be used to support initiatives and professional development that promote and sustain teacher mental health and social emotional well-being through regulation, reflection, and relationship. The key message we really want to portray with this framework is that these pathways, regulation, reflection, and relationship, represent more than a superficial or band-aid solution to teacher stress, like donuts. We should not be adding additional tasks or burdens to teachers' plate, but rather providing them with experiences that are deeper and more meaningful in terms of levels of support and care. And finally, recommendation number 3, let's normalize mental health supports and resources by promoting them, subsidizing them, and embedding them in schools and school systems. Educators in our survey indicated a need not only for specific mental health support and resources, but for the time and space to utilize those resources in school. An example of such embedded support would be counseling for educators. Fuel Ed's provided over 12,000 counseling sessions to teachers since our founding in 2012, and many of them take place on school sites and are directly funded by principals or district leadership. We found that when school districts actively promote, normalize, and create pathways to empower educators to attend therapy, many teachers engage and experience powerful impacts on their well-being and careers. In addition to promoting and subsidizing mental health supports, school and district leaders should directly embed mental health supports in schools and school systems to create an atmosphere of greater relational safety and emotional safety for educators. Long before COVID-19, educators have shared with us the emotional challenges of working in schools, the stress of loneliness, toxic adult cultures, insufficient time or space to grow, the weight of absorbing the trauma that students carry. So if we can create, incentivize, and embed systems where educators both give and receive care as a routine part of the profession, of the daily life of being in a school, this would significantly help to reduce teacher stress and burnout. And in order for school cultures to be these places where educators feel safe, we firmly believe that greater capacity and skill building for school and district leadership in interpersonal skills such as empathic communication is strongly recommended. Now I'll kick it off to Mark to share how we've been collaborating on supporting educators in this work and to close us out of our time together.
Thanks, Megan. So to translate the recommendations that Megan just shared with you, and recognizing that educators from across the country are eager to advocate for better mental health supports for students and teachers alike, Teach Plus and Field Ed held a series of teacher-led training sessions throughout June and July. In these trainings, educators from dozens of school systems from across the country learned more about supporting pathways to better mental health and were provided with a survey template similar to the one Alyssa used that they were encouraged to share directly with their district leaders to help inform the spending of ESSER funds. We're making that same survey template available to you as well, which you'll find at the end of the report you receive, as Megan mentioned. We encourage you to tailor it to your own school, district, or state context to hear directly from stakeholders. We'd love to hear from you if you do end up using this template and encourage you to share it with others. Johan, let's go to the last slide. We hope that our joint report helps inform your work, helps generate more questions and inspires you to act, and helps you continue to serve students and teachers in your various capacities. We wish we had time to engage with you in a Q&A, but if you'd like to follow up with us or the educators who you met today, please contact us. In closing, on behalf of the team at Fuel Ed, the staff and teacher leaders of Teach Plus, thank you so much for joining us. We'll be emailing you the report and additional resources soon after today's sessions. Thank you.